Ending under motions and resolutions, we'll take up the conference committee report on Senate File 278. Senator Jensen.
Thank you, Mr. President. I move that the foregoing recommendations and conference committee report on Senate File 278 be now adopted and that the bill be repassed as amended by the conference committee.
Senator Jensen to that motion.
Thank you, Mr. President. Members, we've discussed this bill before. This is the PBM bill, or the Pharmacy Benefit Manager bill. I'd like to take a moment just to say thank you to my co-authors, Senator Dames and Senator Wickland and Senator Draheim and Senator Benson. And I would like to say thank you to Representative Elise Mann for carrying this bill in the House. The supply chain of pharmaceuticals has expanded remarkably over the last 50 years, from a fledgling little industry whereby we were asking pharmacy benefit managers to process prescriptions because the 1965 initiation of Medicare and medical assistance took place. Who would have known that the onslaught was on? It became so much more than just processing prescriptions. It became a way by which formularies were created. It became a fashion in which pharmaceutical drug makers or manufacturers would reach down to the PBM and say, what must we do to get on your formulary? The perverse incentive of rebates, the tactic of clawing back dollars from local pharmacies, the strategy of spread pricing, where you would pay the local pharmacist $12 for giving the amoxicillin, but you would charge the plan sponsor $50. These things became the rule of the day. So what this bill does is it sheds a bright light on a piece of the supply chain that needs to have a bright light shed on it. Its origin, this bill's origin, was really Senator Gazelka determining that a Senate Select Committee on healthcare consumer access and affordability would be a good thing. Everybody who served on that committee was instrumental in helping this move forward. But I would be remiss if I didn't specifically mention Senator Klein and Senator Draheim for being at my side in the Senate Select Committee. So that idea percolated, moved forward, and in January of this year, Senator Benson and Andrea Todd Harlan and I sat down and said, okay, how do we put this together? The bill was written, we took the jackets, I asked Representative Mann if she would carry it in the House side, she did. And remarkably, if you compare the original jackets to where we ended up today, the essential principal points are still in there. They've been strengthened and modified by stakeholder involvement. This bill is not about demonizing one piece of the supply chain. This is about shining a bright light, and quite frankly, the stakeholders have played an admirable role in this. I would want to say thank you to the pharmacy benefit managers that took the time to meet with us as we shaped and reshaped this bill. So to the bill. It licenses PBMs. It charges $8,500 a year to get such a license. It's essentially a cost-neutral situation because commerce has to have some expenses, and so the revenues come in. So from a fiscal note perspective, it's a responsible bill. It moves forward, defines terms that haven't been defined before. It lays out the business operations and the ethical standards that we expect by going with fair dealing. There's a legal entity called the fiduciary responsibility that we decided to stay away from, in part because this has often been the instigator of lawsuits. We wanted to pass a bill that would be palatable to both parties. So we did that. When it came to transparency, the only way we're going to have transparency in this industry is we have data that we can drill deep down into the weeds and find out, are we seeing the kind of behavior we want? And so the kind of language, the kind of data that's going to be going to the commissioner will be granular data where you'll be able to look at a prescription and see what did the pharmacist get paid, what did the patient pay, what were the co-sharing responsibilities, and what did the PBM profit. In an effort to make certain that we're preserving private health information, the information that's given to plan sponsors is slightly truncated. That was done for a purpose. When it comes to network adequacy, we wanted to make certain that we attended to what is a preferred network look like? How do we level the playing field? How do we preserve the opportunity for independent pharmacies to continue to flourish and stay in the business? Because it's independent pharmacies at the end of the day that are coming alongside of patients, making certain that the medications are being taken the way they should be. The bill goes on to allow pharmacists to work at the top of their license. It provides them the opportunity to substitute bioequivalent medications if they're doing something on behalf of the patient and working with a formulary that a PBM has established. The bill goes on to provide a synchronization method for patients and pharmacists to once a year synchronize medications so that patients don't have to be going to the pharmacy every 3 weeks to get their medicines refilled. In summary, colleagues, the bill shines a bright light on an operational system that needed to have a bright light shown on it. This is just one piece of the supply chain, and I would venture to say that this won't be the last bill when it comes to supply chain analysis. Having said that, Mr. President, I stand ready for questions, but I would want to say once again that this bill does so much in the area of transparency, removing gag clauses, and when I think of a champion about doing that, I say thank you to Senator Draheim for being such a champion. I stand for questions.
Members were on the adoption of the conference committee report for Senate File 278. Senator Draheim.
Thank you, Mr. President, and thank you, Senator Jensen, for all your work on this bill. And I'd also like to thank everybody else that worked on this PBM bill. I know some people that weren't on the bill, weren't even on HHS committee, also help input with the bill. It's something that I think all of us, at least for the 3 years I've been here, have tried really hard to get done. And for me, it's about the transparency, especially with the gag clauses. So thank you.
Further discussion, Senator Abler.
Thank you, Mr. President and members. I just want to stand up briefly and commend the author and all the people that touched this bill, members of the House and everybody who had a hand in this. Some of us have been around a while trying to and noticing what was going on with the PBMs and their ever-growing power. It was kind of like one of those science fiction movies where the little robot monster just keeps sucking up power plants and gets stronger and stronger, and then pretty soon is unstoppable. And a lot of us have, there's certainly benefits to PBMs, and not to go too far off of that track, and they provide a lot of jobs, and they came off as a really white hat sort of a thing, but at the end they became kind of this secret society almost, and you didn't even know what you were getting. And so I want to commend Senator Jensen, who actually finally cracked the code. And for those of us who ran into a brick wall all these years, being told that, oh, if we can't do this, they'll shut down, they'll move. But at the end, I think the legislature is firmly committed to the welfare of the people that we serve, and we want to make sure that these various vendors and organizations actually do what they're designed to do. And I think this strikes a really good balance, and I want to commend everybody who touched this thing and everybody who's going to vote for it, that today we are doing a big thing. And if Senator Jensen only had one accomplishment in his pouch, this would be a major one. And I want to commend him particularly for his dedication and perseverance. Thank you.
Further discussion, Senator Kiffmeyer.
Thank you, Mr. President and members. I stand in support of this bill, as I think many of us do. But I would say that Senator Jensen is uniquely qualified to have brought forward this bill. The knowledge of supply chain is not easily accomplished. To reform the supply chain is even more difficult. You have to have a deep understanding of knowing where the benefits accrue. But probably more than anything, of all the things we do here today, this has direct benefit, both financial and also value in the respecting the patient's time, going back and forth to the pharmacies for repeat refills. Those kinds of insidious ways of leaking your time and your money at co-pays and all of this, Senator Jensen understands and has at the heart of this the patients, helping to reduce their costs, savings to their time, and at the same time respecting the value that pharmacy benefit managers can bring to the whole supply chain process. We appreciate that. But also for our rural pharmacies. Many times those small pharmacies understand the medical needs and look at things in more broadly than just filling an order. that value of our local pharmacies in Minnesota, where now you have a more level playing field between the big pharmacies and the small pharmacies that add tremendous value to their patients, not just filling a prescription order. We really value that. Senator Jensen understands that and put all of those together in a very complex way, but at the heart of it is the care for the patient, their financial checkbook, their time, as well as meeting their prescription needs. So thank you, Senator Jensen. Good job, well done. And Minnesotans, this is a good value for you here today. Thank you, Mr. President and members.
Further discussion on the adoption of the committee report. Senator Nelson.
Thank you, Mr. President. I stand in support of Senate File 278, and I thank Senator Jensen for taking on this challenge, this long overdue challenge of exposing the pharmacy benefit managers, which at one time were considered a way to hold down pharmaceutical costs. And what we have found out over the years, perhaps because there hasn't been the light of sunshine and transparency and accountability, that all too often these pharmacy benefit managers did just the opposite of their original intent. They actually made money by accepting rebates and offers to the PBMs that were not passed on to the consumers whom they were originally put in place to help with lower drug prices. I believe that this unregulated, non-transparent, unaccountable work of PBMs over the last few years has led in much part to the escalating drug prices that our constituents have been facing. So I am very pleased to stand in favor of Senator Jensen's bill today, which I think will regulate pharmacy benefit managers, hopefully back to their original purpose with the transparency that will be implemented here to actually helping hold down those costs to consumers and our constituents. So a green vote for this type of PBM transparency and accountability is long overdue. Thank you, Senator Jensen.
Further discussion on the adoption of the committee report. Senator Benson.
Thank you, Mr. President. And when we heard this the first time in the Health and Human Services Committee, Senator Marty actually commented that this was a big deal, and he's right. Regulating an entire industry is something you have to get right, and it's a big challenge. And I want to commend the author and everybody who worked on it, the stakeholders who engaged and helped us get to what I believe is the right place in regulation, that if you are treating your customers fairly, if you are willing to be transparent about the work that you do, then we're not going to use the heavy hand of government on you, but we do want to know what's happening in the pharmaceutical supply chain, and I think this bill strikes the right balance. I, for one, am tired of finger-pointing between the plans and the manufacturers and the pharmacy benefit managers, each blaming the other for the high cost of drugs, and I hope this is a significant step, and that thanks to this bill that Senator Jensen and so many worked hard on, we will see a change in pharmacy prices in the state of Minnesota. So thank you to everyone who worked on this, and I look forward to broad support on this bill.
Further discussion. Senator Klein.
Well, thank you, Mr. President, and thank you, Senator Jensen, for bringing the bill and for including me on the conference committee. The venerated senators at the rear of the chamber have already spoken so well in support of this bill, so the burden of rejoinder compels me to add to their statements, not to repeat them, so I will be brief. You know, 99% of Minnesotans probably do not know what a PBM is, but I guarantee that they almost certainly have given their money to a PBM, and it has affected the medications they hold in their hand. At best, it is a middleman that determines what medications should be chosen for a certain plan, chooses efficacious and cost-effective medications. At worst, it is corrupted by perverse financial incentives to keep more expensive or brand-name drugs on the market when they should have become obsolete. The most important part of this bill are the transparency provisions. They will have a real impact on understanding cost drivers in drug pricing. We often wonder why drugs are so much more expensive in America than in other countries. This bill takes us down the pathway of finding that answer. And it'll also empower us to do something about it. This bill will also improve health delivery. It will empower your local pharmacist to substitute an equivalent drug, which may be cheaper, easier to administer, or generic, in consultation with you and your doctor, and not at the behest of a PBM. It will reinstitute the natural marketplace incentives of pharmaceutical development, in which the principle that a new or innovative drug is initially priced high to recuperate research and development costs, and that after time, generic alternatives are rolled out, rendering these medications more affordable. PBMs have disrupted that pattern by receiving payments to keep more expensive brand-name drugs on their formularies when cheaper alternatives have become available. And it addresses the conflicts which arise when a PBM has an ownership interest in a pharmacy or a mail-order operation, prohibiting financial incentives to direct customers to their own operations. Lastly, I want to thank Representative Mann and Senator Jensen and Benson for including me on the conference committee. We truly did set partisanship aside to develop this legislation in the interest of Minnesotans. Tremendous credit to them for that process, and maybe it may be a touchstone for the remainder of our deliberations.
Further discussion on the adoption of the committee report. Senator Marty.
Thank you, Mr. President. I'm real pleased with this legislation, a big step forward. I think this will help address pharmaceutical prices. I would be remiss in saying that I wish that there had been one change in the bill, and that is because PBMs are in effect negotiating on your behalf as whoever their customers are. I wish we had kept the language in there. It was in there originally about fiduciary responsibility, because this is a true place where you should have that position where you are entrusted with working for your client, working for negotiated prices to save money for the customer. And that language is taken out, but I want to say there's been good bipartisan agreement on this. The conferees and the authors and everyone did great work, and so I think there more we can do on it, and more certainly we have to do on pharmaceutical pricing, but this bill is a step in the right direction, a big step, and thank you very much for working on it.
Further discussion. Senator Herr.
Thank you, Mr. President. I will be short in the point that I will be making, mainly to express the fact about my district and district that are very similar to me. All the small, locally owned drugstores are disappearing, and I just want to share this comment that the vulnerabilities for a district like mine had two fronts. One front is the customer, the people that live on the edge of poverty, and the second front are the locally owned drugstore. And so they're all, in both fronts are struggling and suffering. So I'm glad that, Senator Jensen are putting this legislation forth, and may not going to be a complete answer, ultimate solution, but at least it will give us some transparency to find out the answer that will benefit us in the long run. So I just want to state this point out to people that I'm glad that our Senate is looking at it, and thank you, Senator Jensen, for doing it.
Any further discussion on the adoption of the committee report? Seeing none, Senator Jensen renews his motion to adopt the conference committee report on Senate File 278. All those in favor say aye. Aye. Opposed say no. The motion prevails. The Secretary will give Senate File 278 its third reading.
Senate File Number 278, a bill for an act relating to health care, creating licensure and regulations for pharmacy benefit managers.
Third reading. Members, any final discussion? Senator Jensen.
Thank you, Mr. President. For those PBMs that thought that they could if you will, have their cake and eat it too. We're saying, no, you can't. We're saying it's a new day. But this is just one step. This body is charged with doing more. Pharmaceutical costs are the largest driver today of inflating costs in the world of healthcare. This bill is all about teamwork. And I want to just say thank you to Andrea Todd Harlan, Tim Bowl, Veronica Fay, Katie Kavanaugh, and Dennis Albrecht for incredible work. The conference committee consisted of Senator Michelle Benson, Senator Matt Klein, Representative Elise Mann, Representative Kelly Morrison, and Representative Jeremy Munson, as well as myself. I did some checking, and I don't know if there's ever been a conference committee before that had 67% of its membership be doctors and still get something done. I would be remiss if I didn't say thank you to Senator John Marty. Senator Marty is, in many ways, just a true gentleman. He comes alongside of you, he helps, he encourages, he gives you ideas, and when you say, those two ideas I can go with and this one I can't, he says, thank you, how can I help? So Senator Marty, thank you. So I won't say what I've already said before. I really appreciate the fact that I was able to work on this bill. Thank you. And I would appreciate a unanimous vote.
Members, we are on final passage of the Conference Committee report on Senate File 278. Seeing no further discussion, the Secretary will take the roll. All senators having voted who have the desire to vote, the Secretary will close the roll. There being 67 ayes and 0 nays, the bill is passed and its title agreed to.